Hello everybody, I'm Dr. Owen Alphin. We're just here with my dog Xena. My son Aaron's helping as a handler for us. And we're talking about orthopedic problems in dogs. Orthopedic basically just means problems that involve the bones and joints. And so when we talk about orthopedic surgery, it's usually surgery of the bones and joints. So when a dog has a problem where they're limping or something like that, obviously the first thing you're going to want to do is get an appointment with a veterinarian to have that problem checked out and see what the problem is. So I'm just going to walk through how that would work with a certain type of situation. So let's pretend Xena here has been limping for a couple of weeks on one of her back legs. So the first thing we would do when she came in is we would walk her up and down the hallway, just look at how she moves, see how she's favoring, make sure which one she's favoring, and then let's suppose that she's favoring this left one here. So one of the common problems we see in the back legs in dogs, probably the most common injury they have, would be an injury of the cruciate ligaments. We call them cranial cruciate ligaments in dogs. In people, they call it anterior cruciate ligament or ACL. So you've probably heard about athletes getting an ACL injury. Well, dogs are very common to get a CCL injury, which is basically the same thing. So what we do to check that out is we do various manipulations with our fingers. We're looking for looseness in that joint. So we'll do that to check for a drawer, or we'll do this to check for a tibial thrust. She obviously doesn't have any of those since she's not injured, but what we're testing for, just to give you some idea of what that means, is this would be a model of the femur and tibia, which is, this sits about right here in the dog. And what a cruciate ligament is it's these ligaments in the center of the joint that cross each other. That's why they call them cruciate ligaments. The one in the front crosses in the front and goes that direction. So when they have a problem with that, this tibia, which is this one, would slide forward in relationship to the femur, which is this one. So we're testing for that as we're looking for that. If we do see that, then we know there's probably a tear in that ligament that's inside of there.